So as we discussed in our last class, aim of the yoga therapy is to improve the glycemic control mainly by enhancing insulin sensitivity, reducing insulin resistance and reducing blood glucose level and glucose as well as HbA1c level. We try to improve the glycemic control by inducing themselves to yoga therapy. Second aim, what is our technique or a tool or a model will do? Reduce the stress and balance the nervous system. What happened is there is a high cortisol level. You already studied in physiology or our discussions in last hour, few classes, that whenever there is a cortisol is increased, stress is increased, glucose will produce more. Other gland also take a role, especially the cortex. So that is why lowering cortisol and the autonomic balance, that is the homeostatic effect through pranayama, asana and meditation. Majorly you can get the control the your blood glucose level. To promote weight management and metabolic health by supporting healthy weight loss, not sudden weight loss, healthy weight loss, improving our lipid profile level, because complication also can lead to heart attack. So improving lipid profile and enhancing metabolism. The fourth one is to prevent or delay diabetic complications. So by improving cardiovascular, renal and neurological health, you all know yoga therapy is not for one system. Yoga therapy is not for one approach. For example, when you induce it to yoga therapy by asana pranayama, all the systems at a condition of health, all the systems are in an equilibrium state. That is why it improves the cardiovascular, renal and neurological health through holistic practice. To enhance the psychological well-being and quality of life. So majorly what happened is yoga therapy, how it acts is reduce the anxiety, depression. Majorly these also causes can lead to increased blood glucose level. Promoting mindfulness and positive lifestyle changes. So this also enhances our psychological well-being and quality of life. So I already told it is a multidimensional approach. As per Taittiriya Upanishad, our body is not only a physical body. Our body is a body of 5 layers. Normally the Taittiriya Upanishad clearly explains which is the physical body, that is Annamaya Kosha. Physical health and lifestyle, you are mainly concentrated. When the sheath of intellect, sheath of prana, energy, pranasyedam vashe sarvam tridiveyat pratishtitam. Our Upanishad, Prashna Upanishad clearly states the prana which is present everywhere, 3 lokas. Mateva putran rakshasva, how a mother protects a child, it nourishes us with intellect. Shishcha prajnamsha videina iti. This pranamaya kosha is flowing. And third is the sheath of emotion and mind, mental well-being. Then beneath that there is a vijnanamaya kosha, sheath of intellect and wisdom, informed decisions, and sheath of bliss, inner peace and spiritual connection, that is Anandamaya kosha. So according to Panchakosha theory, because of the lack of knowledge at Vijnanamaya Kosha level, there is a strong laxant at Manomaya Kosha level that percolate the disturbance of prana, haphazard flow of prana and agitation of nadis, gives the symptoms at the physical level. So our treatment also multidimensional, all the layers automatically we must treat. For example, in Annamaya Kosha, what we do is at the physical level performing asanas. Then we are going to give kriyas, majorly kriyas, physical practices. Then sattvic diet. What is sattvic diet? Bhagavad Gita beautifully says, Ayush sattva bala arogya sukha priti vardhana rasya stigdha hridyahara sattvika priyaha. So the sattvic diet means which gives health, gives ayush, our vitality, sattva, purity in us, it induces purity in us, it induces arogya, cheerfulness, health. So that type of diet, which is sattvic diet, should be adopted. Then asanas, an entire 3 practices, physical practices like walking and losing exercises, and then asanas, which are really acting at the Annamaya Kosha level in diabetes patients. In Pranamaya Kosha level, particularly we give breathing practices. Already you know there is a haphazard flow of prana and there is agitation of nadi. So breathing exercises to restore the energy balance. Breath awareness, expansion of lung capacity through awareness. So pranamaya, by practicing loosening breaths, the breathing practices, breathing exercises and pranayama, we try to balance. There is a specific pranayama and specific asanas, specific practices for diabetes mellitus. In the Manomaya Kosha, especially by meditation, because mind should be controlled, mind should be positive affirmation, mindfulness, relaxation technique, we try to manage, and bhajans, prayers, we try to control our emotions, and Manomaya Kosha. Where is the seedling occurs? Where there is a seed of Adi, that to be balanced. And then Vijnanamaya Kosha, by all their self-reflection, introspection and spiritual inquiry. By spiritual guidance, seeking and applying spiritual insights, disciplined lifestyle, adopting structured routines and informed high decisions, that is making conscious health choices. By this Vijnanamaya Kosha, Jnana, majorly what happened is these people, in simple language if you say, they have a lot of craving to eat sweets, they have a lot of craving to eat high carbohydrate diet because of craving. So what happened is when you self-reflect by Jnana Yoga, by proper knowledge, what is diabetes, what is its complications, what are the causes and how to avoid, what are the complications of you eat unhealthy diet. If all these things you go unhealthy lifestyle, automatically there is a self-reflection in them, understanding in them, so craving rebates decreases, so mind will be stabilized. And Vijnanamaya, Anandamaya Kosha, we try to give happiness analysis. People think that by eating sweets they get happiness in diabetes patient, and getting unhealthy lifestyle their happiness, but happiness is within. By meditation practices, Bhakti Yoga practices, Karma Yoga practices, selfless service, happiness is not in any object, happiness is within. By that all analysis there is a cultivate a acceptance, develop a mindset of acceptance and surrender. So in Anandamaya Kosha. So majorly we what are the practices we are going to give? You can have a quick outlook on research basis. You can see mainly the losing exercises and Surya Namaskara 10 minutes in day 1, what you are going to give for 5 terms or 5 rounds. And then in day 1 we do these all asanas, Ardha Chakrasana, Kati Chakrasana, Trikonasana, Parivrta Trikonasana, especially twisting postures plays a very important role for 15 minutes, 1 to 2 minutes in each asana maintenance. In supine, in day 1, we try to give 15 minutes Pavanamuktasana, Uttita Padasana, Matsyasana, Navasana for 1 or 2 maintenance on 15 minutes. So then slowly in the day 2 we go on add 2 to 3 rounds, and especially in day 1 when the prone series of asanas like Bhujangasana, Shalabhasana, Saraladandrasana and Naukasana, and sitting series like Vakrasana, Mandukasana. So the role is here mainly we try to give in Annamaya Kosha level the asana practices, loosening exercises and kriyas. In that majorly we try to in the day 1 all these practices, how many minutes, after that how much you have to add, we are going to discuss in the next class.